Good morning, I'm Marta Agulli. I'm a cardiac pediatric anesthesiologist and ICU consultant in the cardiothoracic and vascular department at Sant'Orsola Malpighi Hospital in Bologna, Italy. In this webinar, I will discuss about the COVID-19 in the pediatric population, an overview of the literature and the clinical experience reported so far. On December 2019, in Wuhan, China, an unknown cluster of pneumonia unresponsive to conventional therapies emerged. On January 2020, the central government of China imposed the lockdown in Wuhan and progressively in the other cities of the country. On the 18th of February 2020, 72,532 cases was confirmed and 6,532 cases were suspected. The World Health Organization declared a global emergency that became a pandemic on March 11, 2020. As the COVID-19 outbreak continues to evolve, we are learning more about epidemiology, symptoms, diagnosis, clinical syndromes, and therapies. The largest review of positive COVID-19 cases in China was written from China's novel coronavirus pneumonia emergency team. They reported 72,314 cases of COVID-19 diagnosed, of which 44,672 confirmed cases, the 61.8%. Among these patients, only the 2% were children from 0 to 19 years old, of which 0.9% were children under 10 years old. To date, the largest epidemiological study about COVID-19 in children includes 2,143 patients diagnosed in China. The median age was 7 years. The 5.6% presented severe disease or severe hypoxia, while 0.6% presented respiratory distress syndrome, ARDS. This is the distribution of COVID-19 in different places: 2% in China, 1.2% in Italy, and 5% in US. The first case of COVID-19 in children was diagnosed on January 2020 in China, and he was a 10-year-old boy. In addiction, we have very limited data about. Since the virus in children presents only mild symptoms, a significant lower mortality rate, moreover, we had very few swabs performed. The only thing we know so far is that preschool-aged children and infants are more likely than older children to have severe clinical manifestations. So, what about COVID-19 in children? What happens during pregnancy? We know that viral pneumonia is one of the leading causes of pregnancy death worldwide, and every one of us knows the physiologic changes during pregnancy in cardiovascular, immunologic, and respiratory system. And finally, we know that the viral infection increases the risk of adverse neonatal and obstetrical outcomes. So, we have to answer to 4 questions. Did the pregnant present different symptoms from a non-pregnant woman? Did the pregnant woman positive to COVID-19 present an higher mortality risk, or they should underwent preterm birth? Is there a vertical transmission? And finally, how can we correctly manage the parturient, the delivery, and the newborn? First, there are no substantial differences in terms of symptoms between pregnant and non-pregnant adults. Second, in a report of the World Health Organization, in 147 pregnant patients, the 8% of them were severely ill and 1% critically ill. Third, there have been no cases of vertical transmission reported. Virus wasn't found in different samples of breast milk, amniotic fluid, and blood clot. What are the recommendations for infants born from positive mothers? These reported are the guidelines of Italian Society of Neonatologists, where it's recommended to wear protective equipment during all the hospitalization time and during the delivery. More